The IASC was founded in 1992. It's a committee and it exists of all the heads of the different United Nations agencies, plus the Secretary General of IASC and the Director General of ICRC, who are what's called standing invitees to this committee. There is also the NGO networks ICFA and Interaction. ICFA are the European headquartered NGOs, and Interaction are the United States headquartered NGOs. And together they form the committee, which is the highest policy decision-making body within the UN-led humanitarian system. Now, for mental health and psychosocial support, the reference group is part of that committee. We report to a group that's called the Operations and Policy and Advocacy group, where again you have the heads of the United Nations agencies that sit, and it's to those people that we report on a 3 times a year basis. So OCHA is the Office for the Coordination of Humanitarian Affairs. They are a United Nations body and they are responsible for coordinating emergency response activities in emergencies that happen inside a country, be that a natural disaster or it could be a conflict-based emergency. And they deal with what's called internal displacement based emergencies as well. And their responsibility is to convene the cluster system in that particular country in collaboration with the host government or the national government, and to activate the clusters and also to ensure that there is a humanitarian coordinator that reports to OCHA that's in place within each country. So out of the 11 clusters, the ones that are most relevant for mental health and psychosocial support are protection, and within protection there are what's called areas of responsibility, which are child protection, gender-based violence and mine action that are of most relevance for us. There's also the education cluster, the health cluster, the nutrition cluster and the camp coordination and camp management cluster, the latter being of most interest to IOM colleagues. So the cluster system is essentially a pillared type approach that runs quite vertically. It's very capital centric, which means the clusters tend to be in the capital city of the country, and they operate vertically programming wise. So they just look at health, or they just look at education or protection. But mental health and psychosocial support is what's called a cross-cutting issue. It has relevance to teachers working in schools and informal learning spaces. It has relevance for protection actors in terms of social service provision. It has relevance for the health sector in terms of mental health services. So mental health and psychosocial support actors have to basically go around and visit multiple clusters and attend multiple meetings in order to get their programming pushed through and in order for them to advocate effectively for MHPSS.